It's an equation with no simple answer. 1/3 of Alabama's dentists are 60 years or older. At least half of those practice in rural Alabama, which means the majority of rural dentists are eyeing retirement.
We are facing a real significant crisis that right now we are seeing over 80% of Alabama dentists operating within the 13 counties that are urban. And that's leaving only 20% servicing the 40% of Alabama citizens in our rural counties.
Alabama has the lowest dentist per population ratio in the country. Few are on track to fill this void, especially in rural areas.
Even if they would like to do that, they can't afford it. The average dentist graduating from dental school nationally has over $300,000 in debt, and they need immediate income. So they're gravitating towards larger metropolitan areas, not the rural communities, and they're having to gravitate toward existing practices and become employed.
In fact, nearly half the dentists that graduate from UAB leave for other states with higher reimbursement rates, or they go into specialty programs.
The last several years, the average is out of a graduating class of 55 from our dental school, 4 go into a rural area or small town each year.
Dentists who serve rural patients already see the impact. Dr. Steve Mitchell's offered free school dental screenings for more than 20 years. Students in Jefferson County of all socioeconomic backgrounds have little to no decay.
When we step as little as 45 minutes outside of Jefferson County and get into some of our surrounding areas, we start seeing children with much more significant levels of disease.
Dr. Richard Simpson is a pediatric dentist in Tuscaloosa who serves children from 17 counties. Since the shutdown, Simpson's seeing children with far more tooth decay and an ever-increasing number of new patients whose dentist retired as a result of COVID or stopped seeing Medicaid-eligible patients.
We have patients that are driving 2 hours to get to our office. So that's a burden on the family. It's working parents that have to take off an entire day of work to get their child to the dentist because there's no one in the area to see them.
Almost all health-related issues in Alabama are underpinned by a lack of insurance coverage. Those in rural areas have less access to private health insurance.
80% of decay is in 20% of children. And we see similar scenarios in adults because lower socioeconomic status, rural areas, decreased access to care, we see a higher disease rate. We have a lot of kids that are in schools that have free or reduced lunch, and the studies show that in schools that have at least 75% of those kids, they have more than twice the amount of decay as children in other communities.
Insurance further complicates care for children with poor oral health. Children who aren't on private insurance receive dental care through CHIP, the federal Medicaid program managed by Blue Cross Blue Shield and state Medicaid. In the past, dentists would admit children with severe oral issues and treat them under general anesthesia. Over the last few weeks, financially strapped rural hospitals have decreased or canceled dentist OR access, while those with CHIP are covered.
The same kids with the same problems that are just below that threshold for being on the CHIP program and are instead on Medicaid program will not be seen in the surgical centers because they won't accept Medicaid because their reimbursement is so significantly lower. So they're both federal and state programs. Those, one set of kids can go and one set can't.
Simpson was in the OR with 12 to 16 patients a month. Now it's 2 to 3.
We have nowhere to send them. And the waiting list at Children's Hospital for young children that need this care or special needs kids is almost a year. So when they do the initial exam of kids that are in pain and have significant disease state, by the time they're actually seen is 10 to 12 months later.
Mitchell sees patients with developmental delays in the Birmingham area. He's also limited by insurance.
Most of our special needs people have Medicaid as their insurance, and once you hit that 21st birthday, the dental coverage ends. It doesn't matter what condition you have. And once that ends, there's very little ability to get anybody to an operating room.
Dentists are urging employers to offer dental coverage, which in the long run would increase overall health and combat comorbidities. They're also calling on the state to expand Medicaid with a dental program, both of which would help sustain rural practices. Jennifer Horton, WBRC, Fox 6 News, on your side.